So I guess going back to the start of the year, I would have been a fairly average, typical sort of 30-something dad, I would think. Probably stressing a little bit too much about work, ferrying the kids around to clubs, all that good stuff. But I noticed that over Christmas I'd had an upset stomach and that didn't seem to be clearing up. I went to see my GP. He referred me on to a hospital where I had a number of tests. And in the middle of February, a very kindly and straight-talking consultant told me that I had bowel cancer, that it had spread quite significantly, and that it was effectively incurable, and that without any kind of treatment, I would probably have about 9 months left to live.
And you're the family man as well, Fred. So for you, I'm presuming that it is all now about making the most of the time you have left with your family, with your loved ones and your friends.
Yeah, absolutely. I have 2 young children. I have an incredible wife. You know, my parents, my brothers. It's all about really trying to spend as much time as is possible with them, given the various constraints that we've had over the last several months.
And so you're calling on the government, and indeed there are others sharing that cry for you to be prioritised a bit higher than you currently are in that priority list. What would the vaccine, though, enable you to do that you can't do currently?
Yeah, well, you're absolutely right. It's not just me asking for this. 12 very prominent charities signed an open letter to the Times last weekend, backing the points that I've been making when I've been speaking to the press. Really, what I'm looking for at this stage now is urgently to speak with the Health Secretary, Matt Hancock, to get a sense as to, okay, has palliative care and those undergoing palliative care been properly considered and fully considered in this vaccine rollout? And does he agree with me that there is perhaps a special case and a humanitarian case for those with terminal illnesses to be clearly prioritised, so that we can make the most of the rest of the time available to us. You know, listening to your earlier interview with Richard Horton, I'm under no illusions that this means that life would go instantly back to normal for any of us. But early vaccination, I think, would just firstly enable me to spend more time with people like my parents and like my brothers than I'm able to currently. And it would also alleviate a lot of the day-to-day anxiety that comes with small things like doing the school run, going to the supermarket, those kind of essentials, where actually, you know, you feel in my position where you effectively don't have a functioning immune system, that you're exposing yourself to a lot of risk in doing those fairly you know, mundane day-to-day activities.
Fred, we don't obviously want to raise any hopes here, but we did speak a little bit earlier to the Cabinet Office Minister Michael Gove. He made it pretty clear that actually yesterday, at the highest level of government, this sort of situation was being discussed. I just wonder if we can play that to our viewers just now.
It's an incredibly, you know, moving situation when you have people who are living with terminal diseases, and we're reviewing how we can make sure that the most vulnerable and those in clinically difficult positions can be vaccinated. And we were discussing exactly how we can do this in government only yesterday. Obviously, it depends on the number of vaccines that we can secure, but absolutely, when you have a moving example like that, and there are all too many, we want to make sure that people are vaccinated so they can be with those they love at what is inevitably an incredibly difficult and stressful time for the family.
So at the very least, it is being discussed, Fred. But I wonder, if you were to have the opportunity to speak directly to Matt Hancock, what would this mean to you and to the many others who we shouldn't forget are in similar situations, looking at the end of their life and wanting to spend as much time as possible, much quality time as possible, with those nearest and dearest?
Yeah, well, look, I mean, I think that, first of all, that's really encouraging to hear. But what I'd really like to see more of is some urgency around this. There has been some progress in Scottish Parliament. I have to say Westminster has been a tougher nut to crack, if I'm honest, in terms of making inroads. And I think partly the issue is that people perhaps don't fully appreciate the urgency for people in this kind of a situation. When you do feel that you have a finite time left to you, the difference of say a couple of months in when you get vaccinated is actually really, really significant. You know, that could be a really significant proportion of what time you have left available to you. As I say, I'm under absolutely no illusions that life won't simply go back to normal. But nonetheless, I think there is something here that really needs to be looked at, and some issues here that need to be flushed out. And were I to speak with Matt Hancock, I think I'd be saying, look, what consideration has gone into this from the Joint Committee on Vaccination and Immunisation as they've prepared the guidelines? And as I say, does he agree with me that there is a special case here that warrants further investigation and a really rapid resolution?
Fred, it's clear to me, and I'm sure to our viewers, that you are handling this with a dignity that many of us would not be able to possess. And your priority, clearly, is your family. I'm just wondering, as we finish this interview, how they're doing.
They are absolutely remarkable. Thank you. Thank you for asking. They are taking things in their stride. I think we recognise there are some difficult days ahead. But they've been hugely supportive of what I've been doing. My wife is currently keeping the children quiet downstairs before taking them off to school. You know, they've been absolutely fantastic, and I couldn't be more proud of them.